the cattle, sometimes if I look at the subsidies, it's not even balanced. But let's look at it in our context. So for instance, so if you look at Ghana, we want to produce more, want people to consume more fruits and vegetables, okay? Maybe to be prudent for us to give subsidies to vegetable farmers and fruit farmers, so that they may have subsidies on fertilizers, subsidies on pesticides, so that in the end, the cost of production is reduced. And once it's reduced, you realize that you go to the market and you will have, so that can be something that's, well, it's been done in other countries, by the US, I'm not sure what they're very interested when it comes to their policies. In my opinion, they are not, but this is one approach. If some of the farmers will have some subsidies, it can actually help in consuming some of these crops because of the ability and affordability of some of strengthen early detection and timely treatment. Like I always say, sometimes people come into the consulting rooms, and by the time they at that time, the diabetes or hypertension going for screenings weekly, yearly, etc. It can affect the consequences. Once there is early detection, it can improve timely treatment and can also reduce the need for more expensive treatment. At least when you're able to detect the condition at an early stage. There are two main forms of management with NCDs. We have the pharmacological intervention, that's the use of drugs. Pharmacological interventions. So we move on to the role of dietary interventions in non-communicable disease management. It can prevent the progression of some cases, can reduce drug dosage. Experiences you may have, by the time they start the dietary interventions very effectively, usually they will come and they will tell you, it happened to my own mother, she'll tell you she's getting hypo when she takes this quantity, so we had to speak to the medical practitioners and the dosages of the drugs were reduced. When this happens, it makes you know that I mean the dietary intervention is having an effect and it's really helpful in the management. Now my question, in Ghana, as we have it, do we have enough choices in the management of non-communicable diseases? Do we think we have enough choices? Maybe the answer is there, but yes. So I'll be out. Do we have enough? Variety in terms of proteins, in terms of, okay, so it leads me, so that's what I can talk about in the next few minutes. So now we will start with carbohydrates. When it comes to carbohydrates and the management of non-communicable diseases, we are looking at 2 or 3 things. We are looking at will be glycemic system that shows how quickly each food you consume will affect the blood glucose levels, especially when the food is eaten alone. And low or medium GI foods are broken in blood sugar over time. So basically, this is what the GI of the food has been doing. So there is the glycemic control. Once you have those and consume them in specific quantities, it can help reduce the glucose levels, especially in diabetics. Then we also consider foods that are rich in soluble or insoluble fiber. So vegetables, fruits, whole grains, and can be helpful in keeping the glucose levels in check. Fibers will protect your heart by glyceride and cholesterol levels and help to reduce your risk of heart disease. The example is this fiber. that can be found in foods like and help you with weight management. So now let's look at tables. So carbohydrate tables we all know. I decided to bring wheat and oats. Though they are not indigenously Ghanaian, when you go to the market, they are available in the market. That's why. So most of the examples I will give will be indigenously Ghanaian examples, then something that are available in the local markets. So let's look at our maize, let's look at corn, there's millets, there is unpolished rice. Well, in Ghana, there is also polished rice. Then we have sorghum. When it comes to root and tubers, I think one is missing. There is plantain, cassava, yam, cocoa, potato there. I think we've lost that one. Then we have wheat and oats. So at least there will be more examples, but these are the commonest examples we have when it comes to their carbohydrates table. So we don't have the foods. Now, when it comes to GI, so glycemic index is S. Then mid-range GI is between 56 and 69. Then high GI is 70 or more. If we look at this critical, I'll try to read some of the ones you can't see. Let's check maize. Let's check wheat, millet, oats, unpolished rice, sorghum. You realize that all of them have low GI based on the references I use. So it doesn't look bad at all. And does it? It doesn't look bad at all. Then considering wheat and tubers, we have plantain, cassava, we have if we share, then there is potato. So potato will have a higher GI. Is the food that has the highest GI of all the foods. So we can add it basically having low GI, and it's very when it comes to management of non. Now let's look at the fiber content of the food. You can see sorghum. You realize that polished rice will have the lowest fiber with regards to all the foods. That is having a fiber content of 1.1 gram per 100 grams. They realize that potatoes, I think it's 1.2 or something. It's not showing here clearly. But potatoes will also have a GI of will have fiber content of 1.6, I don't remember, 1.6 grams per 100 grams. So realize that most of our foods adequately will have high fiber and can help in the management of the food. So yes, that we really have indigenous available ingredients, especially with regards to the glucose levels. I also put this together for and for carbohydrates, I'm showing the calories found in millets, calories found in roasted plantain, etc. So you realize that a 7 is also below 100 calories, which is also not too high. We can say that it can help in weight management, especially when it's combined with other ingredients. Now let's look at the use of proteins or the intake of proteins when it comes to non-communicable diseases. We consider high quality proteins, non-processed, because processed meats have been linked with an increased risk of cancer and high blood pressure because of the salt preservatives. Then low-fat options, we consider low fat. We also have red meat, such as pork chops, etc. The fat can be trimmed off. That's important because fats, when it comes to pork, it's healthy because sometimes someone can have maybe 2 or 3 servings of pork, but that the fat content attached to the pork is scary. Okay, so once individuals are adequately taught how to trim off the fats, we can have lean meats even from pork. Intake of lean meats will reduce the intake of saturated fats and reduces one's risk to high blood cholesterol and heart diseases. fish. In Ghana, we have a lot of fishes, different kinds of fishes. We have the salmon, we have tuna, we have herrings, which are rich in omega-3 fatty acids. And these fatty acids are important when it comes to heart health. Then we have the anchovies. All these are also high in protein and low in saturated fat. When it comes to poultry, we are totally that will have substantial saturated fat. Then oh, sorry, I don't want to talk. Yeah, yes, right. Can you tell us the difference between red? Other white meat is white. So in culinary terms, white meat are meats that are pale in color and that are found in poultry. They contain less fat and color, beef, pork, etc. So you can say white meat is white and red meat is red, but white meat will have a pale color, while the darker meats are darker with sometimes they have sort of fatty fats, etc. So let's move on to dairy products. In Ghana, different kinds of milk on the markets. Well, in Ghana, we don't have fresh milk. You can't go to where I don't know a fresh milk. But there's fresh milk in the grocery store, but it doesn't look people. So we are not in a country where you can go for that, but at least we have some options. We have a lot of skimmed milk options when we go for. And we had also of the added sugar. I've had this question so many times. When people are asking me, this particular brand of yogurt, is it low fat yogurt? Then I sit down and I ask myself, I wouldn't know. I think we should tell the manufacturer that time policy will come because there are a lot of yogurts. But sometimes we are not able to see the composition of the yogurt, whether it is low fat. So I've had people ask me, dietitian, this one is it low? Maybe they think I should know, but I also don't. So I think that when it comes to our settings, we should be able to information we give, and also if we empower them to ask, is it low fat? Is it high fat? If the people, the attendant, they will even know. We can check, or we can tell our clients to check, because sometimes people are not even sure what to look out for. That's when we how to read labels. Sometimes if someone takes one option of maybe yogurt, per 100 gram, how many fats? This one is 5 grams. This one, the person can make a good choice out of that. And I've talked about lean meat from beef already. Now let's look at beans. In Ghana, we have lots of beans. There is then there is the red one. That one is that is not so common these days. There is a Bambara bean. There are so many high levels of protein and also fiber. There are nuts and seeds that are rich sources, high in fiber, excellent alternatives. There is a soy kebab, etc. Then we have smooths and we have eggs. All these are excellent sources in indigenously Ghanaian foods. Please, if you have any questions, you can feel free to put your hand up, or maybe at the end you can give your questions. So we are moving on to fats and oils. So healthy oils help prevent cardiovascular diseases. So in choosing healthy fats, in Ghana we have a number of them. I have some examples. This considered what we have on the market. So when you go to the market, you can see this interesting sunflower. It looks like it's almost flooding the market. You want to check the levels of monounsaturated fatty acids and the levels of polyunsaturated fatty acids. And these MUFAs are usually plant-based and can reduce the risk of heart diseases. Then the consideration for PUFAs, plant-based, and also they contain omega-3 fatty acid that will reduce the risk of heart disease. So we tell our clients to consume oils that are high in MUFAs and PUFAs, and they should always read labels. They should always read labels. We also want to avoid saturated fats, and they can increase the risk of diseases. Example butter, lard, animal fats, food dairy, some tropicals, that's coconut oil. But when it comes to coconut oil, we know that the fatty acids are medium chain triglycerides that can easily be broken down. So it has levels of oil. Then also small quantities of virgin or coconut oil may be used for specific FDA says about trans fats, but in the US, trans fats, and it's by regulation. Food has trans fats, that's bad. If you are selling foods and it has trans fats, I don't say that. I mean, I have not heard. I don't know if you have heard it. So trans fats, we are supposed to avoid the oils in the ingredients of packaged foods. It will increase the risk of heart diseases than any type of food. Example, margarine, shortness, saturated fats, maybe they are baking cakes, they are baking meat pies, etc. But at high temperatures, the oils can be converted from their cis configuration into the trans configuration. Okay, when this happens, that's when it becomes unhelpful to the human body. So in summary about the fats and oils, we consume oils high in MUFA, PUFA with low trans fats and low amounts of saturated fats, and always read labels. I think when it comes to people, you cannot detect it with eyes, at least. You have to read labels in order to have for the fatty acids. So if you look at sunflower, coconut, and there's rice. Realize that per 100 grams, the calories are almost the same. Okay, so when it comes to calories, fatty acids, even if you take a teaspoon of any, that's what I always say, a teaspoon of any oil, the calories are the same. No matter where the oil is, anointing oil, like any oil, because I have people, especially who want to know you. Oh, in the morning, I fry egg with coconut oil. And sometimes they want to tell you that because I'm frying with coconut oil, I know it's weight loss, so this is not, they're not managing weight loss. So you realize that the calories are so important. So on the extreme right, calories, no issues. Then when it comes to saturated fats, let's take note. Palm oil will have 49 grams. Then of saturated fats, say coconut oil, medium chain triglycerides. Let's look at polyunsaturated fats. Groundnut oil, 32 grams. Then we have soybean oil, groundnut oil. You realize that the polyunsaturated fats that are heart healthy is actually higher in groundnut oil than even in olive oil. Okay, but sometimes because the low oil, we think that olive oil, we can easily assume that when it comes to oil, there is not like best oil. I try to avoid using that. Whereas that groundnut oil is not as bad as perhaps we perceive it to be. Then let's look at more unsaturated fatty acids. We have olive oil 73 grams. Then we have sunflower oil 83.6 grams. So you realize that someone can demonize groundnut oil over coconut oil. Because for me, I think, in my opinion, I think that coconut oil because of marketing strategies. I think that someone wanted to ship coconut oil in Ghana and bring coconut oil in Ghana. Something maybe, in my opinion, I think that was why there was a hype. Because I don't know how many of you said that, oh, now they wanted to press coconut oil. I take my what happened to palm oil? What happened to usual? Oh, it's almost selling a year. You see. Sometimes I wonder. So we have groundnut oil that is equally good. We have even palm oil that has monounsaturated fatty acid that is higher what we find in coconut oil. So basically, then we have, I think I've talked about monounsaturated fatty acid. So this is something we want to take note of. Oh, maybe something I missed out. Okay, so I'll do my assignment. I think I'll look that up.
Saturates means the type of farm used and the method of operation and determining the saturated level. Will it affect it?
It will definitely affect. When it comes to the composition of oils, maybe something I have said, even the composition of ingredients, the research has said that even the location where they plant the foods can affect the chemical composition. It can affect minerals, can affect vitamins, even the variety. So I know there are different kinds of palm foods. Yeah, so it definitely will affect it. But all these are just estimates to our
because I know that for palm oil, you have the local palm and what they call from my experience, that agri is more saturated.
I don't know the website. There are some palm oils. And I think what I didn't do was that means I went with party acceptance part of my research area. So thank you very much for this. I think maybe the next time I have a platform like this, I may have done that research and I can educate as the time. Okay, thank you very much. So you're moving on to fruit and vegetables. At this one, when I was looking at these slides, I was thinking to myself that people say that when you come and talk to dietitians, they will say that it's fruits and vegetables, and it looks like it's a cliche anytime we talk about fruits and vegetables. So I was thinking to myself, how we present this message to the take the when they come and tell them, it looks like what else we don't have to tell us. So this morning when I was doing like that's what I was thinking about. I hope you've been thinking about this. So fruits and vegetables are healthy because of the fiber, making you eat at slower rates, and they contain large amounts of nutrients, including fiber, vitamins, minerals, and various antioxidants, as well as plant compounds. The research has said that high fruit and vegetable intake is associated with diabetes. Now, when you look at Ghana, we have lots of vegetables. Now, yes, you can see cucumber. Cucumber is not an indigenous Ghanaian vegetable, but it looks like when you go to the market, you find it. That's why you can see all the other vegetables. So we have the leafy greens, that's carrots, cabbage, bell peppers, cucumber, tomatoes, cucumber appeared twice, I don't know that. So realize that we have all these in the population, and we are supposed to consume them. But I want to ask us a question. So a client comes to you and says that the plant is diabetic, or the client knows that I have to add vegetables to my dish, no matter how I'm supposed to eat them. And the client says, I want to eat auto. The auto people meals are prepared with GAND. So I said, I want to eat auto. How do I incorporate vegetables in auto? I'm sorry. I thought
so I was so cheese and I learned from it. Okay, so anyone I encourage is to add it to it. As soon as you mentioned the birthday, I think find some ingredients with some individual vegetables on their own. Because the okra, for instance, I know elsewhere they can cook rice, boil the okra, add it to it as a vegetable. So, and in addition to the okra, some people also use the bitter part of the bitter type of turkey berry. Okay. And they boil it and add it to it.
I wasn't sure that I was going to get it. So I have my idea.
That's what's asking myself. I have time. Okay. So you really like allow me to do much of the right. The patient told me for her she uses dandelion. Yes, so when she prepares so she chops dandelion. And then she has some onions with the food itself, so it's not separated from my mother has
Yes, you know what? Sorry, my answer and come on. And so we got as fast. And speed. So when I was watching TV, it was TV and I was a dietitian. Okay. So that was and so I was excited. So the question was, so if you are eating food, if you are eating cake, how can you incorporate them? Can you eat cake for it to help? The first was you don't even have to eat. So that I was sitting on my phone like, I think that in our communication, like we are done to give specific example. The cake, the person of close to something But when you say vegetables, you know, in Ghana, when you say vegetables, okay, so it takes me to my next slide. So when it vegetables, how are we supposed to eat the vegetables? That's the blanket answer you say. Then you take control recipe. So control recipe. So we have these examples: okra soup, control soup, rice soup, that's the vegetable soup. Then we have vegetable stews, control stew, garden stew, etc. Then there can also be steamed vegetables and the vegetable salad. That's what that one is. You have vegetables, but sometimes our communication with the clients, some of these points are not able to come out clearly, and they leave with almost nothing because some of them, I'm not going to vegetable, but I think that we can do better. So let's move on to fruits. So they have antioxidants and can work by reducing the buildup of plaques from cholesterol and other substances in the quantities that need to be targeted. So there are people who will have pre-diabetes and they have heard that intake of fruits is good because when we went vegetables, it's good. So I've had I don't think it's full-blown diabetes with some fruits because she has heard, and it's not somebody who has seen a dietitian, but what to say, fruits again. You know, the way Ghana, you can get into trouble by some of these things. So the quantity will matter. So I took us to
the last point. We don't want to lay emphasis on low GI and high GI.
Okay.
Because the glycemic food is also very important. So they have a high GI, but a low glycemic load. For instance, I think watermelon is very high GI, but the food is very low. So it's all about how much it is. So if you are looking at that, it's the amount that
regarding the intake of your children, my sister one and also finds one about those who is the chemical to spill and then begin and they find to take this other and the time was still you and the vegetable thing how do we get advanced
I have this question. It was like, so I can show it. Someone just this. So I took my time to see someone who sells vegetables. His expertise is in helps. People are talking about so many. What should we do? So I'm a nutritionist. We added. You don't know pesticide quantity and things. So I channel that by and this so it says that there are 3 grades of vegetables. Okay, when it's blue, is the one you plant in the bucket. That one you are sure, 100% sure that when you pick okra, is the okra even as it's not as slimy as you want it. You know that this is original okra. No nutrition, nothing. So our backyard is the first organic food we can have. Then the second one is the one that are grown in the greenhouses. So when it comes to it's not so common here, but I'm saying that one day we will have a lot of greenhouses around where we can back for the wet. So we have the greenhouses that are controlled. So that they have a little bit of pesticide, they may have a little bit of the helpful and can give you minimum hazards if they are. The other one that we can't control. The other one that when it comes to purchasing some of these things, we have to know where we buy them. When I got this education, I'll make sure that when you get there, you can have I'll buy every vegetable item. At least I'm reducing the ones I'm in the market. So that if every day, every week, I'm taking 100 vegetables from that outlet, and I'll reduce the consumption of those pesticides by a half. Or so I think I use
once like the
yes. I know I don't know if there are other answers that I would appreciate it because this question it comes so many times.
So that for me, yeah, I remember when we were in school, Dr. Lutrot, he was teaching us about these foods then I remember they told us that anytime we go to the market to buy goods, because those ones are the ones that the things and then the fertilizers and all that technique because the greenhouse many of the population cancer, but then also for people who are living in a rented apartment, they can't do good. So I think that yeah.
Forgive me. So we actually, all of us, we are like, and you see the one that has holes and the one doesn't have. That doesn't have holes rather. It's because probably the insecticides in it is so high that insects do not even find food. So if an insect,
are now very cautious of the very insects for the objects. Okay. So maybe that the one that's having to mix, they saw it in the spring already, they haven't said what to yes. So now treat it for your make sure we get the whole environment sprayed, not in the box before that they didn't have next study cover it.
okay. Well, I like research. I think that it's very debatable, but I think we can, as I'm knocking all these in my head, we can find out because it should be evidence-based. We should have evidence supporting of these things. So I thank you very much for submission.
Oh, I was going to say that they will be clean.
They will be clean. Okay.
Very
Okay, yeah. They will be clean, especially if you have recipes.
Yeah.
Okay.
Usually I tell my clients that you avoid the usual so that they can have at least the dandelion in these ones, the of the water. But then they come when the rains start. So if you have a backyard and you don't really spray, you just keep, they will just grow at the time. Like they can go in for those ones because you cannot buy
well, that's better.
Submission. The problem is done.
And I will recommend if you put the vegetable there, I can really involve use them to wash your hole. Okay, that's how we should use it.
It's true. So when I put together this, I also consider the glycemic load. For instance, if you look at GI, okay, but if you consider the glycemic load, you have that because of the water and because of the you will not allow some diabetic. So we consider the whole food as that this will be like you said. And now let's look at local and natural spices. I've heard this so many times. The Maggie and everybody has the Royco and the Maggie. If not, you don't have it. So 6 months. So I took it upon my okay. I don't know if synthesize. I don't have a better that. But I don't blended spices. Do not want to use the Maggie. I don't want I don't think so. I've never enhanced it because of the usually what happens is that you need spices, so high amounts of salt in preparing foods. But some traditional combinations
Yes, sir.
Give options that you don't know what happens. Don't come and that is so that you come back.
And they well, yeah, I know this question on so young and it's the other side is that if they are so sensitive and go so and we are so
Shows because I don't want to comment on those because so again.
Yeah, but
So please, for our patients, diet is individual. So even if the patient is hypertensive, we look at the labs. And if occasionally the patient wants to add this on the sugar, and the BP is low for the sugar. Not. But as much as possible, let's do
And then again, as much as encouraging our patients to use the nurse. They should buy the natural things. What gets buy the natural things that you already processed some MSGs to it. And so at the blind side, what you are not, you go for it. You are rather eating it indirectly. And so we can encourage them to use the natural things that by the process of the powder chickpeas for them to eat.
thank you very much.
That's good. What I did next time, I said, I mean, I want to this with them. It's been there for a long time. Between the whatever years to them, like the whole thing.
Thank you very much.
And sorry, on the fruits and vegetables, we're talking about having your backyard garden and it's very nice to know that people test it. And so if you look at their appearance and as where they are coming from because of the they might have backyard gardens. It's a no-no. Because sometimes it's just appearance. Most homes have cemented floors and other, they don't have any backyard. And so when they buy the vegetables in the house, how they prepare and how they consume it is very important. Something I talk about that how many of our patients in quotes will be able to afford vinegars. And so brine is the simplest. As much as the person uses the brine or the salt solution to wash it, we rinse it again before and then sauteing, you didn't mention about steam, and sauteing is quite good as compared to steaming, because sometimes steaming is not too nice for most patients, especially the medicine is used to the cream and other stuff. And so if you saute in good oil.
All right, thank you very much. Any other?
Of this, I think the next some big the next house will start at the was well, encourage us to then have to tell us this. And also the backyard to artisan, we have buckets, those everything attractive. Yes, just create open at them. Yes. Something to put that and add and it's all the
So this question, I remember avoid pies. Yes, so I was thinking we can have healthy options of pies. So for instance, I talked about like making the of some and I'm thinking for pie. So the diabetic can still taking the pie, but it's taking it in a healthier form.
Yeah, someone mentioned composite. I think yes, I was like a function. This year,
And there was a which flag with the compass flag, indigenous, an indigenous product. So that's why I saw bread with sweet potato, and it was quite interesting. So I agree with that. So the sign can also explain.
No, I think I learned this one. Everybody in Ghana is comfortable with whatever they are comfortable with. Adding on or eating from different tribes is a big challenge. So if massive, we can go further to research, ask for to try things that they implement and find ways to rather help them. So you don't really see a girls if not. I tried yeah. The first time I ate surprise. Yeah, it sounds horrible. But it's something we have to ask. Most people be silent because they don't know. We have this now, that's the us. So in as a community, and also
So I love our budget. Bread, are saying, but I think that maybe for the next, maybe ask your cousins the next time we can have something like this. Then I like the books. I think
my last one from what's been just there, we as practitioners should explore, eat more, eat a lot of variety, that we come from experience, not from the books. And so if you are talking to someone, the person is convinced of what you are telling them, then they want to practice it. Because if you practice it, like for instance, before eating season, so I will carry some eat the season, and so it will be. And that is not, and then we should encourage ourselves, eat more. You know, your kids, eat more. So there is people in the same office who are from different ethnic groups. So you know, so let's try and say try.
So I didn't say this. You are the first one. You can't tell someone you can't because this but I don't like exploration much, but I like exploring. So there you go. Okay, so
It's something that we also encourage ourselves our parents to do their own. All the days when they were doing them, yeah, it's still on top. But now we separate it, others put what are we. We are doing certain things that we think let's say the other days of that. with help. So we can bear that in bootstrap.
Okay. Now this is thank you.
Thank you so much. Thank you. So eat variety, at least. You should remember to eat variety. Try new things. Eat more. No, more variety. Many who are like this, you should also learn to cook.
Yes.
And so method of cooking.
Someone has raised them. Regulatory officer. Please, regulatory officer, can you ask your question? So sorry, discussion.
All right. Can you hear me? Hello?
Opportunity.
Hello, can you hear me?
Pardon?
Hello?
It's not the internet, it's just what I'm saying. Yeah, that's
Hello, can you hear me?
Sorry, please, can you type? Can you type for us? We are unable to hear from the side.
Well, not from my end, but maybe I get because
Please, can you type your question? Or if it's a contribution, you can type, we'll read it later.
Yes.
Online participants, please, you can type your questions for us since we are unable to hear you very well. Thank you.
All right. So we take nutrition officer. We are going to discuss the role of policy in the reduction and management of NCDs. Anybody who said this for me, that policies are very important, very. When there's a policy, it applies to everybody. So we are going to discuss the role of policy in the reduction and management of NCDs. So we invite my boss, Mrs. Olivia, to lead us through.
Good morning. And what we are all supposed to be doing it. So what we are supposed to in terms of policies and then hospital environments, the clients, but there are other things we should also consider and be addressed. So today we want you to have a balance as you think about your clients and what's good for your facility. You think about what's the policy makers, the implementers like you and I are doing. So this is the outline of the presentation. I'll take you through the background, why the need for policy for some of these things, the policies and programs, the food-based dietary guidelines, the newest kid on the block, the policy on NCDs, and initiatives like school initiative and then healthy lifestyle program, another new key that is in the pipeline. We also have a school-based food and nutrition education program that we are working on. It also it's all part of this, but it's more children choice, curricular development, and how we implement all these things in schools. And then a call for action for you and I. Okay, so we all know that nutrition contributes a great deal. So is not able to work, will not have a productive person. And so nutrition is key. Is that, and we have children who are healthy, adolescents who are healthy in terms of having strong immunity, infections, severity of adequate physical and social capability for them. So part of our in school has to do with poor nutrition. If they are not eating well, they are anemic, they have a whole lot of issues with them, and so they are not able to perform. And then for adults, if we say they have adequate nutrition, it means that the adults who have lower propensity towards the NCDs, because once they have this NCD, and they become a burden to society. What is the global picture? I mentioned a few of the statistics that over 40 million deaths are attributed to NCD. That's about 71%. In Ghana, 40%. And main categories, the cardiovascular diseases, the cancers, the chronic respiratory diseases, and the diabetes. And so means that this is crucial, and we have to pay attention to. So what are we doing globally and not in India? We all know that we have the SDGs. And so the SDG 3 area of focus by 2030, a lot of our populace are in good health. And then the target, it has indicators, target indicators. The 3.4 aims at reducing about 1/3 premature mortality from NCDs through prevention, treatments, and promotion. Indicators or targets also contribute towards NCDs. Them are the 3.8. They're making accessible, equitable, and bringing health to every individual. And the environmental health. If I know a student who works on a project and the supervisor that he did a survey with growers or farmers in Ashanti and Broma. He says that some of them use polluted water because they don't want their food to decay. They spray overnight. They are supposed to have sprayed the baby spray the night before. If they spray during the chemicals would spray at night early morning in the markets. And that is how come when you buy fresh carrots, sometimes you buy it takes like poison. Understand? So a lot of fear that there will be and due to transfer and all that, as the food is on the way to this crucial NCDs. And then the 3A talks about tobacco control, know the cancers due to tobacco. So the World Health Organization has a framework that as a country we need to look at and ensure that we follow strictly. Then medicines, 3B talks about medicines and vaccines. You know, research into medicines and vaccines that help has kept some of these diseases. And then ability to purchase this and so we talk about health financing in the hospital. Paid by the fact that the government is sick is important. So all these are issues that globally policy makers are thinking about, and Ghana as a country we are also thinking about, and these are so in Ghana, we have very limited data surveys, and I look for certain critical indicators, and you don't have enough data. And so we have this at the back of our mind whilst we try to come up with our policies. And research suggests that the burden of NCDs is increasing. You have programs such as the GIFT, supplementation program, and then we have the service delivery points, and then the demographic. So those the data I just spoke about is from the Ghana micronutrient studies. So if you want to read, then the demographic surveys and indicate that about 5%, less than 5% adults consume adequate amounts of fruits and vegetables. And dietary diversity among children is about 12 to 10%. When you do the meal frequency and diversity, the minimum acceptable diet is about 12 to 13%, which means that they are also not eating a diverse diet. And you see, if you are not used to doing something, you grow up finding it difficult to do it. So these adults were children, and their diets were not diverse. So now people are trying to be healthy. So you realize that in Accra and in Kumasi, people are trying all kinds of things, are increasing in these two very urban cities. So if we do not start or catch them young, and then 41% of adults do not engage in vigorous physical activities. All these contribute to us having people who have NCDs. And so there is a call, or there was a call for Ministry of Health, Ghana Health Service, and other aides and the Ministry of Health to come up with policies that will address some of these issues. As I said, overweight and obesity is increasing both children and adults. During the COVID period, a lot of our children were at home. A lot of the workforce too were supposed to stay at home. And due to the sedentary lifestyles, a lot of people became fat. So we have a lot of issues with overweight and obesity, which we have to address. And then the changing nutrition and food environment is also an issue. Now, every corner there's a pizza, and it becomes something like the order of the day. And so this is also what people consume, and it's giving the need for actions where we are not only thinking about the creative practices, but preventive, and then preventive detection, and then management of the risk factors. So as policy makers, all these were looked at, and then policies where the policy for NCD, for instance, why a need for as I said, increase urban population. Rural would make the population in the urban huge. And so things will be more expensive because there will be improved infrastructure and technology. So you see this bringing up in various places. We go to Accra, papaya is all over, for instance. You see, and then technology, you can be at home and you call chicken man and you deliver the pizza or the jollof rice or the chicken wings. So it's easy. And you take your phone and then the apps asking you to order food. There's a delivery guy who just brings it to your doorstep. So why do you? And then there's still there are issues persisting to NCDs because we are not thinking too much about preventive measures. And then even though we have reduced poverty over the years, there's increased inequality. When you look at the regions, there are inequalities. You see that this region is doing well. It is the equality. Remember, so what we are between the poor, the 10%, and the rich is widening. And so we are not making much headway. All this influenced the need for the policy. There's also the issue of high food insecurity, and it is very high in rural areas. I went to Kandiga last month in the, is it Accra, west or Accra East? Very, and it took us a long time. We went, it was a very long journey. We didn't want to sleep over. And so we left there, we did what we had to do quickly, left there around 4 here. And it was sad that were there, you know, we went for a colleague's husband's funeral. The husband had passed and we went for the funeral. Whilst we were there, we were brought porridge. Then adults started saying something, they'll come and they'll sit down. Somebody who could speak their language asked what they were looking for. They said they saw that we were sharing something, so they wanted some. And in fact, we had a lot. So the moment we sent a few of them, a lot more came with their bowls. I was shocked and I was so sad that they were in their homes. Someone we don't know was eating something and we're willing to just join. You understand? So poverty is really, or food insecurity is really an issue we should still consider. In some cases, it's not about the food not being the market, but it's about the expensive. Actually, all that it's so expensive, and so people know the right things, but cannot buy it, and so they're eating the jar. Someone, instead of going to buy a difference, so that the soup will look nice, and then when you, or someone will buy the hero or the so that when you buy it, you eat the meal, that one bite can take you through the thing. It's terrible. And so there are really serious issues, and agencies under it consider developing a policy. Undernutrition among young women, adolescents, and women still persist. Some people are underweight, some are overweight and obese. And then nutrition can stay double belly. Now we are anything triple belly. So some people have micronutrients deficiency in the same household. These really are issues that are quite alarming and disturbing, and hence there was a need to take action. A food like this is a typical Ghanaian diet. So most people do not know how to even be salted. And last time I read, there was a research in from formerly, all these things happening around us. And this is what someone would eat. So quality, and they are not diverse, as I said. And the intake of it frequently, not quantity, is a problem. And for those who take, we don't take variety. Then the legumes and nuts, gobe, or banana with granuts, or roasted plantain and nuts, unless you are taking maybe soup that we take it. So that one we have a problem. And then the latest is an issue. Refined foods, fried foods, all over the place. It's terrible. And then we are eating a lot of pasta. We are buying more food than preparing or eating meals. So we hands. I think I was talking about the food environment, about the springing up of this fast food foods are even cheap. But in some cases, it's very expensive. You buy a bucket and it's so expensive. Meanwhile, healthy soup for the entire family would have this, and the children are wasted, So it's a problem. And that's diverse standards across government agencies. Let's say Ghana Health Service is trying to reduce intake of sweets and unhealthy food in the school environment. And then we are there, and an agency comes and they put up, let's say they put up a stand, they are sharing. So all the education you did on four-star diet and all that goes here, tell them, oh, mommy, I want Indomie. And of course, it's easier to cook Indomie than to cook the control stew and then add a staple to it. So the mother will just put water on fire, pour this thing and add the additives in. She's done. So the agencies, let's see the food and drug authority, they authorize it. So they provide a particular product to them, they check it, but an adulterated one is on the market. And even the storage conditions, leave things under the sun, a whole lot of chemical reactions going on. So we are not working as a unit. So all these are issues that governments considered and then came up with these policies. There are a lot more policies when the Ministry of Ghana Health Service website. The initial one was reviewed not too long ago. National Nutrition Policy was the National Food Safety Policy, the GIFS program. We have guidelines that we use. And the Nation Friendly Food Initiative, I'll talk about them on the next slide. And then planting of food jobs, because you know that to have a sustainable food system, how we even handle waste and losses, and how for the individual to be free of the NCDs, we need to consider how the food is being produced. She talked a lot about what the farmers are doing. In fact, anytime I remember an incident that occurred in Bantima Market, I feel so sad. I was going to buy fresh pepper, the pakush that's just best and it has this nice. Okay, I wanted the red one, I wanted the green one. And when you put it in your soup, you don't use too many fertilizers and the chemicals. So, and when you buy, initially you could just put it outside, even in fridge, and it gets rotten. So I'm just telling them that when you go to talk to the families that they can send it, otherwise it's affecting us. A lot of people will die, a lot of people will get cancer. Send it. When you, I was thinking that because I she was the market the farmer. They send them when you, that then my friend really swap. I can plow a whole farmland and plant, but at the end of the day, I have so much losses that I do it so that I can also get some money. Now farming is expensive. So I wouldn't be able to and I never went back there to buy. You know what they do? They farm a certain portion that they don't apply chemical to, and they consume that. Then what? And she's not willing to change practices. This I think if we want to curb NCDs, and then new kid on the blog, food-based dietary guidelines, which was just launched, I think in February. It's one of the things that will help us curb NCDs. And if we want a sustainable food system, we need to think about diversity, resilience, inclusiveness, and connectivity. It cannot be done in silos. Everything has to be done in unison. The linkages should be there. If I talk to the school and somebody else comes and does otherwise, we will not make headway. And the responsibility and then mind if we want to have a sustainable food system. So these are pictures of a few of the policies that we have in the system we are working with. For the food-based dietary guideline, I think you all know about it. Just came that we are now, the dissemination will be done later. But for Ghana Health Service, we have been exposed to it briefly in some of our fora. It's a tool that guides for majority population, and it is supposed to help us know what the optimal diet is, and it's supposed to promote health and well-being and performance. We are saying that the workforce will be impacted if people are not healthy. And then it is not a prescription to treat disease. And for the people living with HIV and so on, we have masks. But it's not to serve such programs. This is not intended for such people. It's a guide to all of us seated here. And then it provides practical recommendations, because when we were teaching nutrition friendly school initiative initially, we're even using a healthy plate for it. But now we have our own type of Toniwa with portions. So we are trying to make progress here. So that is what it is. And recommendations are in two parts. One that has key messages to individuals and then families. Information on what they should do and how. Because it's a useful tool that will guide us at the various levels as to how to come up with the policies. And institutions such as the agriculture and fisheries can take it and do something with it if they are initiatives. School feeding. Ghana Health Service, School Feeding Engineers collaborate on that program. And so a lot can be done based on go for monitoring and so on, and see things not going well. And you can't do anything about it because of the political influence related to that program. But still, to serve as sunlights at the parliament or political level. And then LEAP. Now, Ghana Health Services work on that program as stations in selected districts to the beneficiary. If they have diabetes, hypertension, so they refer them. If they have an abuse issue, they refer. There was this incident where there was a new messages girls prostitution quotes, and she was living in a particular room in a compound house. So when she sees the beautiful SHS girl, she moved with a rich man in the community. So our CHNs went for this program to look for a new household, see that she should try and enter the ministry. So of course, when you go into the household, you have to screen people in the household. So she tried to screen her. And when she entered her room, she saw that she had created the room such that it could be used for service and all that. Through the people to put a stop to what she was doing, because a lot of the young girls were getting pregnant, some were getting the STDs. So we partner with them on that. And they will not only look for health conditions, they are supposed to look for the to see whether they have it or it's expired, and they refer to social welfare for renewals to see whether they pay for services in terms of health. But we will add nutrition to it once they are with knowledge from the food-based dietary guideline. And then the food service institutions, our schools are not doing so well in terms of what the children eat. So it's supposed to also help them. And then in terms of food processing and value addition, between what we do. All this I think I have spoken about in terms of food system. These are some of the core recommendations which I think you know about. I want to skip, can I? Eating the various, we call it 4-star diets, but the food groups. Ghana Health Service, we make it simple and then avoiding certain things. Now, let me talk about the policies. And the NCD policy and the new program that I should say married together, they all have the same core guiding principles, and they all approach health in the school initiative. We are saying that we want to catch the children young, inculcating the right habits them right from the school about exercise, teaching them about fruit days, and then egg days, or some people protein days, where in some countries, getting an egg to is a problem. So we encourage them to have egg days where each child comes with an egg from home and they eat together. They bring fruits from home and they share. Greening the environment. We want to teach them that the environment should be clean. And during the rainy season, they grow flowers, they grow trees. And for some regions, they actually plant food. And so those who are in boarding schools can get maybe pampa tomato harvest, and they use some for their food and sell some to buy other things. Some are into poultry, and so they get it. And we also teach them about hygiene. And so we have a guide, and which has the package of services for the nutrition-friendly school initiative. For the GIFT program, is the program that helps us give iron points to women in the fertility age, but a special category, the adolescents. Don't give to the general because we can't afford. And we give only to the girl children because we have data on girls of poor performance, and the poor performance is from issues such as high anemia levels. And so we go into the schools, they screen them, and those who are anemic are referred to facilities, but those who are not anemic, every Wednesday or day in a week, they are given a tablet to swallow to ensure that they don't have light and healthy lifestyle. Because if we want to go into each program, we could spend a lot of time. That's a brief overview on that. And the goal of this program is to reduce mortality, morbidity, and which is associated with results in NCD and other emerging diseases. How do we achieve this? We want to achieve through increased awareness and provision of healthy diets. And then we want to do this by increasing access to screening for early disease, easier to manage. But for some people, last month or so, one prominent pastor in Obuasi died due to cancer. It was detected at a late stage. Very young, vibrant man. So some of these things, we are we could prevent some conditions. And they want to develop systems and linkages to care and preventive and promotive services. So these three activities will help us achieve the ultimate goal. What is the scope of the DA to get the entire using this approach? It seems we always focus on those who are sick and they come to us. We try to do health promotion and education to losing patients. And so we want a system where we have a program that will target everybody. And then we want to provide targeted service for different age groups while we strengthen the existing programs and interventions. So we have program for the young ones, for the adolescents, and the but now Ghana Health Service has come with a unit that is supposed to work on that well. And so women in the reproductive age or fertility age have specific things that are targeted at them. And then it will be implemented across our nations. There are 16 regions, so every region would participate. Now, the guiding principles. These are the same guiding principles that are in the NCD policy. For each policy that you come up with, there should be seated on a shelf. It can't be used. And so we are guided by principles, and then we come up with certain strategy policy. So it should be evidence informed. Why do we need policy? We should be able to use available data, both from research that is done outside or globally, and then locally. So what we are working with to make decisions. That is how come we always have to think about how we are trying, whether we are just keen. I think the decisions don't do that. Because sometimes the data, when you sit at the regional level and you look at it, it doesn't make sense. Sometimes, let's say they stop breastfeeding at 3 months. Because when you assess them for exclusive breastfeeding at 3 months, the percentage is so low. But at 6 months, huge percentage. How can these same people who do not do breastfeeding at 3 months now do breastfeeding at 6 months? It's not possible. Are they visitors or what? You understand? And that indicator, for instance, there is a reason behind that. When we are targeting tiny introduction of complementary, those putting in the data think that we are targeting exclusive breastfeeding. So rather than count in the register or ask questions, they just use their mind and do some magic. And so they don't know the impact. But when you sit in the office and analyze the data, then you will see it. So before policies are made, it is based on evidence. And then cost effectiveness. You know, come up with a policy. I think don't the structures available, it cannot be implemented. So understand. Otherwise, and we can't just implement the NCD policy vertically, implement it vertically. We need to look at this cost effectiveness. Technical working group to do the same thing, the things from here, the things back from here, we would reduce our cost and then implementing. If I can work on the NCD policy that is side, then why don't you use it? Why do you use for another person to do those and you have to pay them? So cost effectiveness is also considered. And universal health coverage agenda is also considered. Will it be something that everybody can benefit from a certain geographic area? Then it will be cost effective to the nation to implement. And then we also consider primary health care to travel in certain environments. So you have to consider everybody whilst developing the policy. And you should be able to integrate it into service delivery. If now with the policy and we are supposed to do certain things that you cannot do in your facility, go out for public health activity. We can't do the things, then it is not worth it. There should be something that we can integrate into the services we render and achieve the ultimate goal. And then we should be able to build partnership and promote institutionalization Otherwise, we'll have issues with sustainability. There are programs that Ghana Health Service invest in, and then when funding stopped, it collapsed. One typical program is breastfeeding champions of North, and a program comes to make a lot of noise, social mobilization and all that. But if we do not do this well, we can't sustain it. It's not breastfeeding. Now we are 43. We've gone back like so. And then they must start the use of technology. Now we are trying to put some of these programs on apps. A lot of resources is on phones and tablets. It's an app that the health worker can access to guide an adolescent on various issues. Currently, in GAND, we are trying to digitalize some of the services we render, so that we see what's in our PNC and then CWC. Sometimes the health workers do not know how to do the counseling. You know, in infant and young child feeding, testing, assessing, analyzing, acting. Assessing, analyzing. They can assess and take the highest, but what does it mean? You know, Mr. Asiedu said they take labs from clients and decide on a tailor-made situation for a client. That is what we are seeking to achieve as nutrition. We get to this age, we don't mention education, we mention accepting that. And whatever you doable action. Because sometimes talk about one and we don't know them. She's telling power that she can use the religion that she cannot afford. And then you tell her, you are talking and doing a one-on-one counseling. Assess situation and tailor-made down the approach. You go and come back and not be able to do it. But if you agree with on 2 to 3 doable action, the client, and so we are using all that to improve our services now. So very soon now we have some apps we use in the Ghana Health Service, Sleep Tracker, Scorecast, and all those things. We are trying to go digital. The districts have been developed with tablets and so on. So that if CHN, for instance, with the phones and see that this age is low, I need to act. Understand? Otherwise, you just key it in, or should just write it in my book and let that sleep. Or maybe it's a young child, the child is at risk of malnutrition, and she may not be able to identify that when they put it in an app, the app can tell them that, oh, this is an at-risk child. Pay attention to this. And then what messages do you give to the client? All that is the app. So and receive the app with policies. So for the DHL, what is the package of services? Health and nutrition status screening, promotion of physical activity, nutrition and health promotion and education, and then promotion of the consumption of healthy diets. So what are we doing currently? And activities are all in the NCD policy. So for the screening, currently we are screening SHS And then preschool, we are screening the KG people. And then adults. Now we have wellness clinics in facilities. Do we know about it? Yeah. Some people know. Okay. We have wellness clinics where people walk in and they screen them for a whole lot. Then they are attached to the right place or given the right treatment. Now we are coming up with a well similar. And that one is gender sensitive. And then screening for the aged, as I said, is also another area we are looking at. Now, how are we promoting healthy diets? Currently, as I said, the nutrition-friendly school initial feeding that we do, we have guys on that. It's also addressing that. And then now we are seeking to collaborate more with partners like FDA, Ghana Standards Authority, and the food industry to ensure that certain recommendations that we give are being followed. And we have right messages as agents. Otherwise, then in terms of health promotion and education, we have a concept called, oh, if nobody has seen it before, it's on TV and Joy Prime. It was being aired a lot during COVID time, late afternoon. It has cartoons like the way we have cartoons. So that we get the patient right from the young age, so that we will not have the issues we are dealing with now. So in terms of communication, we have the Kofi Commando concept. And then, as I said, we are developing the school-based food and nutrition education guide. We just had a technical working group meeting about 2 weeks ago. Very soon, it is things that we will be doing in our schools. And then we need to develop advocacy and communication because when she was presenting, I realized sometimes we are not able to. When we develop a cooking guide, World Food Program project in 2 districts, mothers were trying their hands on foods that they were not used to, because it will tell you how to prepare the food. Even though we had our messages on how to prepare certain things, like the way you said they were cooking, so all those things are they're teaching them how to handle the vegetables and all that. So if we develop a lot of material and you also use them in your counseling, it will be easier for clients to understand what we are telling them. And so we need to develop more key physical activity. We are using initiative to promote physical health. They will enjoy doing those activities, and it will reduce a sedentary lifestyle. So that vehicle is used for that purpose. And the NCD program is working with nature also to physical activity in adults. So as I said, the Kofi Commando concept initially was started at COVID-19, so that children know about it and how to protect themselves. But now it has been broadened to cover a whole lot of issues, including education, that will help them do the right things to prevent them from developing these NCDs. So the children are very important to us because we want to prevent the situation. And we can prevent if we put the thing in the inculcate the habit in them. If the child goes and cries that she wants an orange, it's most likely that when the mother is having the complaints, she will buy for the child. And when they buy for the child, other people get to it and to influence the entire as agents of change. And so this is the target for that program. It's for both rural and urban. They always want to have. So they should be watching for these things so that they get proper message. And then it's targeted at children 16. And then we are even thinking about that YOLO where the teams are interested in watching those things, want to see whether important messages so that they get used to it before. So that I was talking about, you've seen it in some of these issues. A lot of people, only 3 of you have it. It's on TV. And it's not on a paid channel, it's a free channel. That's recommended so that the children will start to write. So that we have to have and then the death and all that will reduce. Thank you very much for listening. You know, we are going to yeah, that's right. These are some of the things we support what we are doing in the facility.
Very interesting. This is so forth. Just because this this working because we have a lot of food safety issues.
In fact, it's being implemented bodies. You go to FDA, for instance, and seeing this on the market. Why? They are challenged, but I would have thought that they can start small and then gradually change the environment. The only time got funding from UNICEF. So when they get funding, they quickly do it fast, and that's done. They go and the person is doing the wrong thing. They take and do not do the right chances that they are destroying products. I think we've all seen this before. So for some, I think they are working, but they need some like whistleblowers. You go and buy something and it's not right. And you do follow up. But they said that the enterprises are so many, the markets are so huge, and they have few personnel. So they cannot go around like we expect. So they depend on us to also act. So I would say that they are trying their best, but they have challenges. But I think all of this is in force. The person of food for food and I don't want to talk about. You and I, what you know is what I also the two things after it's all being implemented by us. What are they called? The caterers provide fruits. They tell us it used to be 50%. Now they made it 90%. I hear it's now 150. The effect is too small to provide with. But the argument from the government is that it is per child. So when you put it together, it's a lot of things. So they use their own funds. And of course, 5,000 CDs and get a cheaper, maybe a flavor to or color. The food look red. You have to speak. Some of them have to borrow with interest. But government is not able to pay them. So we train them, but the practicality is an issue. We're supposed to use farmers in localities to supply food to schools or places that they should be cooking. But sometimes the contract is given to the school we own. And so in that same locality, someone is going to where to going with. You understand? So that all these, as I said, the food-based dietary guideline is a new thing. They are now working at disseminating at all levels, but it has taken force. So they're all working. They're all working.
My question, whether on recently, we all know the 36 page by the moments about that. And of this daily initiative was something to look at that I'm saying in relation to health, when it comes to food, when it comes to some of the what are some of the dimensions, if they are, that are
from the Ghana Health Service, and we are not looking at that. So the best we are doing is we have an advocacy INC material supposed I'm saying that in terms of Galamsey, Ghana Health Service, we are not doing any direct thing as far as I know. But then I know that we have the INC material processed on cancers, and as part of the message on it, Galamsey is mentioned, the mining activity, mercury and all that is spoken about there. But we don't have a direct policy that is targeted at that. I don't know if you know what you know is what you know.
About SHS screening. Initially, they were doing it, but in recent times, I don't know if it has been stopped, but you mentioned it as part of the current programs ongoing. So I want to be sure if they've stopped it or it's still happening in some schools. Now you're mentioning the S6, water and sanitation, so that there's no policy to cover that.
That's right. I should have water pollution and all that. That is how come, but I should have added that. And that's why Galamsey comes in. In terms of the school screening, we are still doing it. Just that the last batch of screening we did, payments is delayed, and facilities complain of reagents we use when they are doing the screening. You know, they fund themselves initially, and then government reimburses. So because of the delayed reimbursement, it has slowed down, but we have not cancelled it. I'm sure when the right payments then we will continue. So that is effective. If we have a facility that is kind enough to do the screening, and we'll be happy. But for the gifts, they are still screening, because if you don't screen, so we screen all of them. Those who need that at the facility before we have question. Okay. It's a school-based initiative that have a package of services. Look at vitamins. Vitamin A, we have chefs at the district level, but we don't have chefs. We have health promotions. The teacher trains CHNs that are around a particular school carry out so encourage friendly school initiative, nutrition friendly. You should be dosing your children with vitamin A. You know, when they start school, the mother not take them to the CWC for the vitamin A. They are supposed to take it till 5 years, every 6 months. And so 2 years, this is earlier than 2 years. Once they finish with the immunization vaccines, they don't go. And so we have to follow the kids to the school and dose them. So under that initiative, we have to give vitamin supplementation. We have to encourage clean environment. So we look at IPC, that will have a hand washing day. When children play and they are, when we started, we got water that we collect when they wet, their hands are dirty and they eat with it. But it's a point where there's water. They will go and wash. And of course, we are saying that there should be soap and then, if possible, tissue. During COVID time, schools had tissue and all that, so it was easier. Now, COVID is past, so they are asking them to health, those things for them. They are supposed to work. It's a community approach. So PTA is involved. We talk to PTA about the package of services. And so something like the wash facility, sometimes some PTAs or assemblymen take it upon themselves to do. Then the washrooms, we look at how clean their washrooms are and what kind of washrooms to eat. When they break, what kind of foods do they buy? So in some schools, the food vendors were trained on providing healthy diets. They were asked to dress properly, they have aprons, they have care. And then schools were educated on the fact that they should not sell stuff and drinks and those things to their children. So that is also part of the package, the food environment. And then exercise. You know, they have physical activity, but not all schools do it. We encourage that it takes during COVID, they were doing the physical activity, some exercises, it's also good enough. So we encourage physical activity. We encourage them to observe PEDs or physical activity day. And then cleanliness, hair, handkerchiefs or tissues and all that. It's also part of the package. Then food day. We realized that they were not, and then the children bring food from home. If you don't have, the teacher has every get it. Sometimes they bring a whole pineapple. The teacher will peel. Fruit salad and share for their children. They also consume, so they even do salads. And I've seen this is a broad bread. They salad and they bring their own tea in the school. You know, so so I think. These are the, and then about deworming. Then we talk about gifts, where those who need the iron and folic tablets are given. And then we talk about smart school, and it's not an acronym. A situation where we have student ambassadors who are change agents. So we train them maybe on menstrual hygiene. We have a girls' class. We tell them, okay, this is what to do. So they go into the community and talk about education has identified a particular problem. The data case is too much. I think the water source is bad. So they can even use these children to change the services that we render, expecting that the children will be healthy and grow up being healthy adults who will then practice healthy lifestyle in terms of health. So it's a package of services. So before you can qualify to be a nutrition-friendly school, we are expecting you to carry out these activities. I left out one thing: greening the environment or beautifying the environment. The environment to be friendly to children, or painted bottles and decorated or marked areas in the school compound. White and beautiful, colorful areas in the school, just to make the school friendly. But we couch it to the ultimate thing is to make them conscious of their diet and their health. Are you okay, please?
Nutrition friendly, and what's the word to get?
So some regions, we give certificates and teachers are proud of it, and we recommend them, right? Yeah, access to the national level. The certificates most of the time. In fact, the teachers take to get teachers jumping, female teachers in exercises and all that. Cleaning, you see males weeding and sweeping. It's fun for those who take it seriously, actually. And the ultimate aim is to improve school attendance and reduce dropouts in come to school. And for some of them to the fruits, if they don't come, they won't get. In some of our regions, parents actually wait to see food being brought, like for school feeding, to ensure that the child takes that one meal because they can't afford. Watching to see whether their children will get food. There was an instance where a child collected the food and was rushing to go and eat and fell in the hole, but she's calculated it was so bad. And the instance, there was a guy who was giving food. He took the egg, it in his pocket and the food. So when he goes home, the egg will be the same. So for some of them, the cost of that, in one of our districts, the headmistress has tested to the fact that when they started this program, their attendance has improved. Because when they come the fruit salad and the fruit, they are excited. That's the only thing to improve attendance.